Hi, everyone. My name is Eric Hewson. I'm back from earlier this morning. If you remember, I was fortunate enough to be able to give the welcome speech, and I'm going to be the moderator for this empowerment panel that we're going to have. A little bit more about my story. I was sharing earlier how I laid in bed for 2.5 years, and I was just gone to the world at the time. And while that crash I look at as one of the most challenging stretches of my life, it also led to some of the greatest opportunities of my life. And it shifted my perspective in terms of how much I appreciate the little things in life now that I took for granted before because of how much was taken away from me. So today with this panel, we're going to be talking about how we can overcome various challenges that life throws at us. Whatever the timeline is, the frequency, the level of the impact, and how we can learn to jump those hurdles and use what we've picked up along our path to gain perspective and begin to thrive. And it's thrive because of those challenges that we faced. So before we get started with the questions, I've got some formal introductions, which is why I'm reading off a piece of paper here. Okay, I like to usually do this a little more loosely, and what you're going to see what's going to happen as the panel goes on. It's going to be a discussion. It's going to be like us sitting together because these chairs are comfortable, like it is. We're in a living room, and we're just having a chat and getting to know one another. So first off, meet Hillary Cassell. She's the co-founding partner of Cassell & Cassell Attorneys at Law and proudly lives with bipolar 2. Notice she isn't defined by her disorder. I said lives with bipolar. Through a nonprofit, Namaste the Stigma Away, she advocates to normalize the conversation around mental health challenges and to expand treatment opportunities for those struggling. She's currently a candidate for the Florida House of Representatives, District 99. Also, thank you, Hillary, for being a presenting partner of the summit. So, welcome, Hillary.
Thank you for having me.
I don't know if we're all supposed to clap. All right, so next, I'm going to go a little bit further down on the panel. We have meet Dr. Andrew Pleener. He's what's called an integrative psychiatrist, and I was mentioning integrative a little bit earlier this morning. And the founder of and the director of our Same Here Psych and STAR Alliances. In 2019, he founded Regional Psychiatry to serve Central Florida with an integrative approach to patient mental health care. Dr. Pleener is a diplomat of the American Board of Psychiatry and Neurology and a fellow of the American Institute of Stress. So welcome, Dr. Pleener.
Thank you, Eric.
Then this guy. Oh, man. So, Mr. Brent Sopel, originally from Canada, he calls it God's country, as do many. I was commenting on how beautiful his socks are earlier, so you could take a look at those in a little bit. He's a retired professional hockey player after having played 18 years, most of them in the NHL. He won the Stanley Cup in 2010 with the Chicago Blackhawks. He's the founder of the Brent Sopel Foundation of Dyslexia and suffers with it himself. He's proud to be sober now for 5 years and was pretty recent to my recollection. It was in the last couple of weeks. So pretty awesome if you're out there hearing it can be done. And has been blessed to find his purpose in life, and that's to help anybody he possibly can through his foundation and through mental health and substance abuse advocacy. So welcome, citizen of God's country. And then we have Dr. Amy Sanchez-Zadok. Amy is a professor of psychology at Nova Southeastern University and an organizational strategist and life editor. So we're going to hear about that term specifically as we go through the questions with her. Her methods have helped many accomplish their vision by using determination and goal-setting tools. She holds a master's degree in mental health counseling and a doctoral degree in educational leadership and human services. So welcome everyone on the panel.
Thank you.
And before I even dive into this question, I just wanted to off the cuff say we've got two folks on here with lived experience. I'm going to throw my hat in there as well, someone with lived experience. And then we've got two professionals. And I think so much of this discussion around mental health, we had an earlier session on some of the practices and the modalities. We were taking through various breathing and yoga. We're going to dive in this session into the day-to-day of what it's like to live with these challenges, because I think all of us do. It's just to varying levels. And then what we learn from what living with those challenges can do to propel us to greater things down the road. Because, and especially when we were meeting with the steering committee for this summit, the theme was, well, you hear about mental health and it's often shed in a negative light. And how do we flip the switch on that? How do we shift the paradigm and start to talk about it in a way where we can look at mental health in a positive? You open up a magazine about physical health, and you see people talking about bigger shoulders and six-pack abs, and then you open up a magazine or a book on mental health, and it's what could be going wrong in their life. And I think the beautiful thing that we'll be able to discuss during our time together here right now is a lot of what we learn from the challenges we face and how that's able to help us thrive moving forward. So I'm going to start with both Hillary and Brent in this case, and I'll be polite. I will start with Hillary specifically, Brent.
Going with beauty first? Are you going beauty first?
Yes, I'm going beauty first. I mean, that's an obvious. So you've both been pretty open about the challenges you face. Brent, the term dyslexia, which led to comments from other students when you were a child and even teachers in school that you were, quote, and I know this is an ugly word, dumb, and couldn't keep pace because of your difficulties reading. Hillary, you've been open about your struggles with bipolar too. But let's talk a little bit less about the actual diagnoses themselves. When you think back to, everything that you've struggled with, where do you think the strength came from to overcome what you did? I mean, we were having a personal conversation, Hillary, about you look back and you say, speaking to a large group of people right now, that's easy for me because of what I face. So where does that inner strength come from? What does it feel like? And what does propel you towards after I don't want you to say you've overcome it, because there's no such thing as being cured. We're always a work in progress. But talk a little bit about that resiliency and how it's gotten you where you're at right now.
Happy to. So I was diagnosed over 10 years ago. At the time, I had been practicing law for less than 4 years, and my dream was to be an attorney. But I also knew that I could no longer balance both, that the job was physically killing me, and I needed to either decide to walk away from the practice of law, something I had worked my entire life for, or get a grip on what I was going through so I could be that amazing lawyer that I knew that I could. So really, there was no choice. And I'm one of those people, if you put me into a corner, I'm going to find the best way and the strongest way to get out of it. And it took a lot of self-awareness. It took a lot of recognizing and understanding that it was okay to not have perfect days. And I think with social media, unfortunately, we see everybody's lives as being perfect. And it took that grace and kindness with myself to say, I'm not perfect. I'm going to have a bad day here and there, but I'm going to get a hold of this, and I'm going to do the things that I want to do with my life and help people. And that, for me, was the motivation to make sure that I could continue my career that I had worked so hard for, and to be healthy. I didn't want to live in the manner in which I was living. So I really just didn't have a choice.
So I'm going to dive deeper into that answer. And sorry, Brent, he's like looking at me like, come on, I don't get to go right now. It sounds like your North Star was continuing on that path towards the career. And I can relate to it because I mentioned being, spending 15 years in professional sports, having that chief revenue officer role. I could say at the time, I was just thinking, I want to get back to having some sort of reward center again, some sort of ability to think clearly again. In the throes of what you were dealing with, you still were able to hold on to this idea and this vision of my life. Part of why I'm going to work the way that I'm going to work to get, and almost, maybe this is the right term, rehab my brain back to a place of functionality again, was very much driven by career and what you were looking to accomplish. Is that fair?
Yeah, absolutely. I mean, at that point, like I said, I had been practicing law for 4 years. I was $160,000 in law school debt. Doing anything else just didn't seem like a possibility, and I'm a fighter. So I wasn't willing to give up that fight, what I'd worked so hard for, and I was really fortunate to get help early on from people that believed in me, that told me I could get through this and that I could conquer this with the right resources and with the right attitude. And again, I'm one of those people, if you put me in that corner and tell me no, I'm going to find a way to do it.
Sure. I think it's such an important lesson for everyone out there, and a theme and a takeaway, because I think we're in the throes of the battle. It's hard to make sense of the world. And to be able to say, okay, I was this before, and I know I can get back to that, and that's a big part of my motivation, is what gives you that path forward. So thank you for that. And, Brent, I know you personally, right? So I know a little more about your story intimately, and you've shared, you didn't even know you had dyslexia until 32, right? Was that the number? And so in school, you're dealing with people telling you you can't, you're bad at this, sorry, you're not going to get very far. And that weighs on a child at a young age. And so where did that resiliency come from as a young kid to be able to push through that, because you didn't even have the diagnosis at the time. You just had people pointing the fingers at you.
Yeah, the 3 words that I heard was you're dumb, stupid, and lazy. You talk to anybody growing up and Johnny's in the corner or he's sitting out in his 90 chair. I knew I wasn't lazy because I was an athlete and that's all I did. But dumb, I still think I am sitting here today. I still think I'm dumb. You tell somebody something long enough, and especially, as a kid, you're in grade 7, you just want the good-looking blonde to like you or your buddy to like you. That's all you want. And you can't fit in and just be normal. And when I mean normal, you can't read. You look to the left and right. Why can't I? What's wrong with me?
So you're saying it was ingrained in your brain at a young age so many times over and over again. Still to this day, many years later, it's difficult to drop that thought from your mind and believing that about yourself. And a lot of the work that you've had to do is try to distance yourself from the way in which people were defining you in a way.
Yeah, 100%. We all can read. If you can't read, you can't get a job, right? So I play professional hockey. Thank God I had that because, Eric, you're right. Obviously we've talked intimately, good friends. I would have been dead years ago. I've looked at suicide many times because the simplest things, if I'm not good at math, if somebody's not good at math, there's a job for you. But if you can't read, what do? There's a reason why 50% of people in prison have dyslexia. And, when I retired the game of hockey, still to this day, I haven't gotten a salary since I retired. What's it been, 6-7 years? Nobody would hire me. So as a young kid, your prime reading areas in grade 3 and 4. I was reading in grade 4 in high school, to give away, you're in high school reading at a grade 4 level. So Cat in the Hat books, I've never read a book in my life.
Wow. And, we hear this a lot from professional athletes, but I think it goes beyond just professional athletes. It's anyone in any profession who's striving. I almost think they take the challenges that they have faced and they say, because of those challenges, here's this other area that I can excel in, and it pushes them that much more. I think that's why we see, again, the most public version of that is you see the athlete who's the first one on the field, practicing harder than anyone else, staying the longest, watching film more than anyone else, or wants to make partner at the law firm, right, and is doing doc review nonstop. And it's almost because of, and there's balance, right? When the doctors are going to look at me and be like, hey guys, wait a second, that's a little bit too much, right? But it's this balance between I've been told I can't do something or I feel I can't do something. This is something that I'm excelling at right now. I'm going to put my energy and effort in that right now. Is that a fair takeaway from both of your stories?
If you have no self-esteem, you've got nothing. I don't care if you're a rocket scientist or whiz kids like these doctors. If you don't have self-esteem, you're going nowhere. The only place I could get my self-esteem was on the rink. So that's the only place I spent my time. So, are you a musician? Are you an athlete? Do you want to be a lawyer? Do you want to be a doctor? So you're going to work and you got to focus. You got to find that one thing to get that self-esteem, because you go to school for 8 hours, you do this, and if you can't get it back up, it's like a tank of gas. It gets
but the theme of what you're both sharing also is that there's not a person in this world who isn't challenged with something and doesn't, let's say, not perform well on a test or, performance review in a certain area, and that's okay. Like, I want everyone to know that, because I think there's this idea of perfectionism that because you're a great lawyer, you also have to be, a great spouse. You also have to, and we all want to be great at everything, but to your point about self-esteem, if we get on ourselves for not being great at this one thing while we're great at these other 10 things, that's going to be what pulls us down.
There's no such thing as perfect. Nothing. Nobody's perfect. The one thing you're never perfect at is yourself. Why? Here I am today sitting, meeting new people, so new people came in my life. Tomorrow it's going to be something else. We're never perfect. There's nothing perfect. And that's okay.
I think hearing that from someone who's won a Stanley Cup is pretty impactful. So thank you so much for the vulnerability and sharing that. I'm going to loop the doctors into the conversation now. So Dr. Pleener, and I mentioned the doctor who ultimately ended up helping me practice integrative psychology. So, you know, the approach that you use, treatment of mental health with integrative tools, and there are different things that work for different people, right? We just said that different people face different challenges. There's also different things that work for different people. So said simply, as an integrative doctor, even hearing some of the challenges that I've personally faced, because you know me personally, and then Hillary and Brent have faced, can you explain in more detail how the integrative model works? Why you're drawn to it as opposed to, let's say, traditional psychiatry? And I know you have a little bit of your own personal story, and why you believe in it so strongly.
Yeah, thank you, Eric, and thank you for both of you, Hillary and Brent, for sharing vulnerability. The conventional model of mental health care has been very much based off of diagnosing, based off of the DSM-5. If you have 5 out of 9 of these symptoms, you have this disorder. If you have 4 out of 9, we're not really sure what that is. And using med management as the conventional tool, a lot of which have side effects. Traditional talk therapy, CBT, is sometimes used in conjunction with it. Integrative psychiatry is a little bit away from focusing so much on the DSM, more on how stress and trauma from life's various challenges impact us, because our brain doesn't have a delete button. And just like some of the things we talked about here, childhood traumas, they stick with us and they disrupt our psychological processes, make us more likely to have ruminating thoughts, cognitive distortions, lack of psychological flexibility, or cognitive fusion, where thoughts are stuck with us and we're fixating on it as opposed to letting them diffuse. But how does that actually impact us hormonally, affecting cortisol levels, adrenaline levels, norepinephrine levels? How does that impact neural circuits, leading to inflammation in the cells, changes to the vagal nerves, which is, you know, what we talked about a little bit on the earlier panel before, the importance of breath work to stimulate that. But you start to realize our real physical architecture is starting to change, and these disrupt our digestive rhythms, our circadian rhythms, impacting our ability to absorb micronutrients and make neurotransmitters. And how do we start looking at all the ways to really push those psychological processes and impact those circuits in the right way? We can use conventional meds to dampen symptoms. We could use vitamins and supplements and lifestyle and better nutrition and botanical products, and then we could use ways beyond breath work, whether we're talking about, you know, different types of tapping techniques, or we're talking about alpha stim or neurofeedback or aromatherapy. I mean, there's so many different ways, and then the modalities even beyond CBT. There's, you know, we talked about ACT and EMDR, accelerated resolution. And then lastly, thinking about how underlying medical conditions, whether it's in, you know, autoimmune conditions or, you know, things like elevated sugar in the arteries, how does that actually impact our mental health as well? And then working collectively to push all that back in the right direction.
So Brent referred to the left side of our panel here, which might be the right side of yours, as the brainiacs of the group. So I'm going to take what you just said. Well, yeah, right? Like for the rest of us. Well,
listen, they got all calls of education.
The degrees. But said simply, Dr. Pleener, only because I lived it and I experienced it, I think there's this perception when we hear about mental health that mental health is about disorder. You either have the disorder or you don't. You're on one side or the other. And if you have the disorder, here's the two main ways you get better. You take medication and you go to talk therapy. The integrative model, which I didn't hear about until 2.5 years into it by default because I tried everything else, is that the brain and the body have a connection. And that what we see and what we experience impacts the neural architecture of our system. And if that gets impacted, we need different exercises and different modalities to learn how to heal something that's been affected over time, as opposed to just waiting for something to kick in for us. And I think that's an important message for folks to hear. As you know, Dr. Zadok, we talk about the life editor, right, in your field, and that's a program I'm assuming that you came up with, right? It's something that you developed. And I guess the question is similar to the question to Dr. Pleener is, you know, you look at traditional psychology and psychiatry, and it is very much based in a regimented way in medication talk therapy. And I think common misconception out there as well. If I raise my hand and I admit to this thing called mental health, as opposed to just realizing mental health is something we all have, well, then I'm submitting myself to taking these pills, which I don't want because I don't want to take pills, or sitting on a couch and having my head shrunk, right? All the things that we hear about that keep people away from getting help. And at least what I just heard from Dr. Pleener, what my own experience has been, I'm sure we're going to go through the modalities that you both have used. It sounds like there's a lot more out there to help people.
Tons of things. And it's interesting because the Life editor came up. My daughter's a writer, so that's how we got that idea. She was editing some papers, and we had this conversation. Wouldn't it be great if we could just edit parts of our life? And that's how that was born. And it's interesting because there's so many pieces and so many rules. And I think when it comes to modalities, we're trying to figure out a rule that fits for us. And we live by rules. It doesn't matter what it is, whether they're in our head or whether they're given to us through our parents. So when we discuss mental health, it's really being really creative. And I always give my students an example of take a paper clip and how many things can you do with one paper clip. And this is what you're going to do when you are in an office with your clients and giving them therapy. Because we have cognitive behavioral therapy, which is the CBT, and that's wonderful, and it works. And there's so many other modalities that work. But sometimes it's the therapist getting really out of the box and hanging out with you for a day and saying, how do you live your life? How do you multitask, which we take that as pride, and we're really life multitasking. We're doing so many things in our life. And when we really take a look at multitasking, it doesn't make us smarter or better. It actually makes us confused. And I think that's a lot of the pieces. So the life editing is really taking your life, and we're not trying to change you. We're trying to say what works for you. Like Hillary mentioned, there were certain things that work for me, and then forget about the ones that don't. Maybe we need to work on those. Maybe we don't need to work on those. But why not focus on what makes us feel good mentally?
I love that. And especially it resonates as I was hearing Brent's story, because he's talking about so much of the pain of what he dealt with as a child. And it's to be able to look at that experience in the past and say, how do I rewrite that? Which, again, by the way, is different than sitting on a couch and just being said, told, tell me about your story. Okay, tell me about it over and over and over and over again. It's learning strategies to rewire, right? And we're going to get into rewiring a little bit, Dr. Pleener. So back to my lived experience, folks, who are just as intelligent as everyone and brainiacs as much as everyone else. You had to make a decision to share your story at some point, right? And I'll chime in on mine in a little bit of where in the process I was. But in both of your cases, where in the process related to your healing journey were you when you made the decision to be public about it? And obviously public comes in many different ways. Public could be, I told a close family member, or public could be, I'm on a stage in front of 1,000 people talking about it right now. But was it a conscious decision that you made? Who did you share it with? And then why did you choose that time in your life to share it?
So because I'm an attorney, my career is overseen by a licensing board called the Florida Bar. And as a result of that, I did not feel as though I could share my story. So receiving my diagnosis as a 4-year lawyer, I really put my head down and I stayed quiet and I didn't share because I was worried, would I be fired? What client would hire me? The crazy lawyer. So I didn't share my story, and very, very few people knew about it, only close people in my life. And I reached a point in my career where one, not sharing the story was not healthy for me because it was a huge part of who I was and who I evolved into. And I had opened my own law firm with my husband, Michael, who's my partner in Love, Life, and Law. Hi. And, it was the first time in my career that I didn't have a boss that I was worried about sharing my story with and possibly losing my job over. I had established myself as an expert in my field. I'm very specialized in the type of law that I practice, and I realized that this was the time. And I'm also, again, one of those people, if you I'm going to take it to the next level. And that's what made me found my nonprofit. I reached out to the Florida Lawyers Assistance Program, which is the only nonprofit that provides mental health and substance abuse to the legal community. And we are 3.6 times more likely to suffer from mental health and substance abuse. Combination of our personalities that are very type A to get us to law school, but also because of the nature of the profession. But I was practicing law for over 11 years, and that I shared my story with the Florida Bar. They did a stigma-free campaign, and I was the first attorney to launch their campaign to the entire legal community as a way to try to bring awareness to the profession, to show a positive example of a lawyer succeeding while living with a mental illness.
I love that it was on your mind that you wanted to share earlier. And for everyone who's listening right now, it's 2021, it's not 2025. And we're still at a place in society where we fear if our boss, our manager, our director, our VP, we know how the corporate structure works in the US and beyond. The fear is if I share my story and my challenge, two possibilities. I may never get promoted, or they might find some reason to let me go. And it took you getting to the point where you were your own boss, right? Is that the right way to say it? To be able to say, my story is important, I need to put it out there. And the reason why we're having this panel is because in the idea that, yes, Hillary's sharing something that I have this thing called a mental illness, right? But mental health lives across this continuum. And all of us face challenges that might not get us to the point fully of mental illness and disorder. But the more we're open and we share these challenges, and you have someone who is, a partner at a law firm, a founder of a law firm, or a CEO, a C-level executive that opens up, what that does is it normalizes conversation, and it helps office leaders realize what we are is an office of people who do struggle. It just happens at different times and at different levels in our lives. So I thank you for your openness, and I'm sure many people do out there. Brett, in your case, you're a public figure. And so how do you make the decision to open up?
I talked about sobriety. So pull up my calendar. It's been 1,839 days since I was okay to do that. And I had to get sober. Drugs and alcohol are part of all sports, and probably a lot deeper than people realize. I think I cracked my first beer when I was 5.
And you did that I'm only jumping in because I know your story.
Yeah.
You were in pain. And people calling you names at 5 years old, you maybe saw someone in the family who turned to alcohol. So you're like, I guess I turned to this based on how I'm feeling.
Yeah, we're born with the right brain wired differently. So when we grabbed that first book, 1 year old, 2 years old, as your kid went to kindergarten, that's when we start struggling. For example, Robin Williams, he's dyslexic, but nobody talks about that. So our dyslexia, kicks off our depression, anxiety. So, my dad said, back in the day, go to the store with this letter, get 2 packs of smokes, or Brian, go get me a beer. No problem. I cracked it open. I'm like, oh, this is unbelievable. I'm 5. Most kids want Kool-Aid. And the ball just kept rolling. And yes, I was in pain. I wanted to be normal. I couldn't. So I had to get sober. And, it took me a while. I came out publicly. I guess my life is public. I've myself, my kids have lived a different life. I'm in the public eye. But I'm here today. It's not about me. It's about everybody who's watching right now.
But you've shared your story on our website and our social media channels. Do you remember the age you were when you first shared with the world your struggles?
That was when I got sober, honestly. So I think I was maybe 6 months sober, where I was finally feeling okay to feel the pain, and I needed to feel those feelings sober. You have to understand, covering up with alcohol and drugs is, not to feel it. I had to be okay with my parents did the best they could with what they had at the time.
And Hillary shared the fear when she had bosses. You're playing in the NHL. You shared just after retirement, essentially. We work with a gentleman named Robin Lerner, who's the goalie for the Vegas Golden Knights. And he's been very open about the fact that his openness has prevented him from getting long-term contracts. And so when I mentioned 2021 versus 2025, it might sound like, Eric, you're up here leading a panel on empowerment. How are you talking about the fact that it's keeping people back? What I'm being is real with everyone, that the reason why we're having these panels is to show how normal it is to struggle. Whether there's a label with that struggle, where there's not a label, the only way this stigma stops is not by pounding our hands and saying, stop the stigma, stop the stigma. It's by having these conversations and sharing what the day-to-day struggles are. And so, and going to both doctors now, I'm going to start with Dr. Zadek. I hope you don't mind, Dr. Polino. We'll switch the order here. You're hearing 2 and hopefully 3 lived experience stories here where there's an openness. But as doctors, you have doctor-patient confidentiality. That's part of, I guess a benefit that you have by treating patients. Where is that balance? Because I know as someone who speaks publicly and talks about my story often, and I'm assuming you guys will shake your heads as I'm saying this, there is something cathartic about being open. And while I do get to share things privately with my therapist on a weekly basis, I think that there's healing pieces of being open. So when for everyone out there who's listening, what is that balance? Is it different for everyone? When's the right time to find our voice? Who do we share with? I would love to hear both your opinions.
I love that question because it's the client-therapist relationship is confidential. So any relationship you have with me. However, if you want to share it, then we're going to walk together and find a way for you to share it, because it is very cathartic. Keeping a secret and keeping it in a room contained with your therapist isn't going to serve a purpose. So as our job is to educate you, and I really like the word education so much more than therapeutic, because therapeutic takes that negative tone to it. So now we're just walking this road together, and we're going to figure it out. And when you walk into my office, I don't know where we're going. And the first thing is the burden of trust is on me. I need you to trust me, because you're coming in and you're vulnerable. And that's a very scary place to be. So when we talk about the mental health and being cathartic and opening about it, yes, I encourage that. But let's do it in a safe way. Because we're living in a culture that every story is told through social media. And if we don't get enough likes, we delete it. Because my college students do that. We have a class just on that. How do we understand what you're trying to show the world through your social media, right? Likes
do not mean what you are worth.
Exactly.
Just want to share that.
Exactly. And neither do followers, right? So, but this is now what we do. And in sports, wasn't it about numbers? Sorry, but it's about numbers, right? So it's like when you take a look at that, it's depending on my numbers. So we're living on that. So together, confidentiality is absolutely 100%. But if you want to share your story, we're going to find a way to share your story that you're going to be proud of it.
And I'm taking the words of you, if you want to share your story. You and Dr. Pleener both talk about having multiple modalities, a whole tool belt as doctors to help people through. Do you ever proactively recommend sharing because of the benefits that you might see from other patients? Or does it always have to come from the patient first saying, I feel like I want to get this out there wider?
It depends. It really depends so much on the person. So yes, sometimes I think there's a reason to. I'm sure we have our own personal stories. And when I went to therapy, I remember my therapist saying, you need to share this story. And I am not ready to share this story. So it all depends. But then at least the thought is there. So you need to share it. How are we going to plan on getting you there if you ever do get there? It's scary. It's really scary.
And let me jump in. Whatever way you share it is the right way. Back to nothing's perfect.
Exactly. And that's where we find that that perfect ground. And I was talking to someone earlier, and it's incredible because in theater we do dress rehearsals. So what I incorporate too is a little bit of a theatrical improv. I'm sure all of you have heard of improv. So what we do is we incorporate that within the modalities, because now you have a dress rehearsal for whatever you want to share. And whether you have to be in the environment or if you have to understand the audience you're working with, that changes the whole dynamics, because now we're training that brain to say, oh, this is very familiar and I feel comfortable. And those are little pieces.
I'll say this coming from someone who's tried out different therapists, and again, please either agree or disagree with me with head shakes but having a therapist who's willing to share some of their own vulnerability create space to allow us as patients to open up more. And I just want to share that because I'm sure there's many therapists who are listening right now, professionals who are listening right now, and there's always been this line between, do I need to be perfectly buttoned up and show that I'm the doctor, they're the patient? And I'm sure there's a piece of that. But just know, coming from people who are pouring their hearts out and are looking for help, we're able to open up more when there's an openness shared, even the slightest bit on your end.
Well, the interesting piece, we were just talking about that, because when we talk about our rules and our licensing, we are not supposed to share, right? So it becomes a little bit of that gray area, and how much do you want to say, and what are they going to come back and say, well, you said.
Right.
So it is that balancing, but yes, it's very important to be human.
Yes.
And I think that's really the key, that we are human just like everybody else.
Yep.
The degree is just an added value, and you know that, right? But at the end of the day, we really need to understand what you're going through. Empathy. It's pure, raw empathy. And that's what we try to engage with, or at least I do. And a lot of therapists do. And it's changing. We have to understand that mental health, we used to put people in dungeons and chain them up. Not too long ago, only 150 years ago.
Yep. Now
we're saying, wait, let's sit and talk. So yes, that one-on-one talking in a room is a big jump from being in a dungeon and being chained just because you're having an episode.
Yep. I think too, physical health, you think of Jane Fonda and Richard Simmons, how to normalize getting up and moving and sweating to the oldies, right? Like, we take for granted that physical health wasn't so normalized to get up and start moving. We're still in the infancy stages. That's why these conversations are so important. You know, Dr. Pleener, similar question with respect to your patient's openness. Do you sometimes promote it? Do you tell them to do it? Is it part of connection? Where is the line?
You know, I love the theory behind acceptance and commitment therapy. There's such a big piece about being vulnerable there, being able to tolerate the feelings that come with that vulnerability, and making commitments towards the core values. You know, there's something neurobiologically linked from the time of birth when it comes to wanting to connect with others. You know, I'll give you two examples. You take an infant, you put an object in that infant's hand, and you put your hand out, and they'll literally give you that object, look at you in the eyes, and smile, not because they understood the instructions. They wanted to get this feeling. Nerves in the body are changing, and they don't realize that that's what's happening. It just feels good, and they want more of this. And Stephen Hayes, who founded ACT Therapy, did an experiment where he had a bunch of people in a room, and he gave everybody the homework assignment of find anyone and lock eyes with that person for 5 seconds. And the ones that locked eyes, they had this feeling of special. Like, it didn't matter how old they were. It didn't matter if it was 15 or 85. And then the opposite was the ones that couldn't lock eyes with somebody, had this feeling of, what about me? Like, who's connecting with me? Just as powerful as this connection and yearning to belong, when we experience rejection and disconnect, with the brain not having a delete button, we all know what it's like to have a breakup or not make the sports team or get rejected in various aspects. It could be with friends and families. It sticks with us. And what do we say after that? We're never going to be vulnerable again. We're never going to risk that rejection again. The problem is that we're not building connection. And we're not actually feeling like we truly belong because we don't feel like the others around us know the real us. And when we're actually inducing vulnerability, one, we feel that they understand us, and you're actually helping somebody else connect as well because they're connecting with you. So I think, you know, from whether or not there are rules or regulations of how licensing is mandating the way people should practice, there's something inherently positive about vulnerability that I think should be encouraged.
You know, you made me think of when we first formed the name of Same Here, right? And I shared it with a friend who was hearing it for the first time. And he said, So it's kind of like a tribe that everyone in the world is already a member of. They just don't know it yet. And I think it's so important, by the way, not taking credit for it. It was someone else who said it, but I love the power of that, because when you share your story, you start collecting people. People come to you and they want to share. You've created that safe space for them, and that connection that's there, I think, is healing. And tell me if you both agree. I think part of our journeys, and we're constantly on that journey, we're never this thing called cured and it ends there, but I think part of our healing journeys are the way that we connect with people. We're able to put our story out there. That's what keeps us moving and ticking, right?
I mean, for me, I felt alone for a really long time. By keeping it a secret and not sharing my story, I had nobody to talk to about the things that I had experienced. And I told my story in a really big way, all at once, and by putting together a video with the Florida Bar, and that reached international legal communities. I was receiving messages from lawyers in Europe, lawyers in South America, getting calls from moms who saw the video, and it freed me. I realized I no longer had to live in that shame. I was putting the stigma on myself, but I realized I wasn't alone. And there's so many more people out there that have the struggles, whether they have the diagnosis or not. I don't think the diagnosis at the end of the day is what's important. I was struggling. I was struggling to find the balance in life. And so is everybody else out there. And there's no shame in that. And there's nothing wrong with that, except if you don't do anything about it.
I think that's so powerful. I mean, the connections that we form when we share, it's magical. And how many people started reaching out to you when you shared, had a similar experience on my end, and just couldn't believe that people were opening up, not because I was a doctor, almost because of the vulnerability that I had put out there. It was fascinating. And so it leads nicely, Brent, into more and more athletes and public figures have been sharing lately. I'm going to hold back opinions because I want to hear your opinion on this, because I think is a balance of what is shared, how is shared, and how it is shared. As someone who's a public figure who has shared their story, do you think we're at the right place right now in society with the general trends that we're seeing with the openness of people with platforms, or do we still have a ways to go?
We can go down a rabbit hole with this one. You and I have many times. God put me here. I've got a platform. I'm telling my story one person at a time. And the one word that I get from people when they watch that documentary is raw. I'm just telling you the truth. And that's where I think people with a platform, whoever that is and on whatever level, I think that's where it gets changed, because they're not being real. I'm all about action. When you tell your story, there's an action piece to get to that story, and there's an action piece after. Not just saying, hey, I'm dyslexic, and that's it. Tell everybody I'm dyslexic, and nothing there. Well, how did I get there? What happened to me to finally, getting diagnosed, with dyslexia? And by the way, that was getting my daughter tested. So thank God I did pass it to her, being hereditary, because I wouldn't know, we wouldn't be here today. So what was my pain and struggle to get to that point? And the action piece after to be able to sit here. And I think a lot of people on the platforms, athletes, they're trying to capitalize financially instead of capitalize on reality.
I'm going to dive a little bit deeper, because I think it's going to lead to a question for Hillary. Is there are a lot of buzz terms out there in mental health right now, and if you are someone with a platform who raises your hand and says, I have XYZ disorder, it's endorsement dollars coming your way. The problem is the details of what you just shared. What led up to, what were the struggles? What was the day-to-day like? What were the interpersonal relationships? Bam. Then from that point moving forward, what am I now doing to manage, as opposed to, here's this organization that I partnered with, you should use them? Is that a fair paraphrasing?
100%. Money doesn't buy happiness. I've had millions of dollars. I've lost it. Am I trying to get it back? Yeah. Doesn't buy happiness. So I can sit here. I've had both spectrums. I struggled. Got here today. Still struggling. Telling you the truth. You know, I think I had a 30-minute cry this morning, not to be honest with you. You know, I broke down this morning at 5 a.m. That's reality. You can judge me all you want. That's fine, because guess what? You know, we got 40, 50 people in here right now. Unfortunately, y'all couldn't be here live, but that's the truth.
I thank you for sharing what you faced this morning. I think any of us who have to come up and present as many times as we've done it, the natural angst of that comes into play, even though, like you said, it is part of our job. There's not a person that I know that goes through day to day and they don't have a hiccup along the way. It's maybe not captured on TV all the time, but it happens, and it happens frequently. So, Hillary, back to you. You know, you've been very public that your diagnosis is bipolar 2. Do you mind sharing a little bit more of the vulnerability of what were the struggles that were part of leading up to that? Whether you believe that some of the challenging life events led towards the development of this thing called bipolar, or the struggles of the bipolar itself, either or both are fine. I think that's the important piece, and that's what Brent's trying to share there, is for us to connect with everyone out there. When we lead with just the label, someone else might, well, I don't have bipolar 2, so I'm sorry, I'm on this side, Hillary's on that side.
Sure. So I think one of the important parts of this conversation is understanding that most of the images we see of somebody with a mental illness is the most extreme scenario. We see the depressed person that's not functioning, or we see somebody with bipolar, which is Angelina Jolie, in a psychiatric ward. And those were the only images I had. So leading up to my diagnosis, I didn't realize the things that I was experiencing were anything other than I'm having a bad day today, or today, you know, I'm working 80 hours a week, I'm not sleeping, I'm traveling all over the country, I have really, you know, hard deadlines, I practice in federal court, you know, handling really big cases, all this pressure, I'm a lawyer, I have to be perfect, I can't make a mistake. I just thought that was my life, and the highs and lows that came with it, because I didn't have an example of that. You know, I was a functioning, you know, successful attorney, and from all outward appearances, I had it together, but I was also trying to figure out ways, you know, to crash my car into a median so I could check out of life for a little while. And crying all the time, and those were not normal, but I was still performing at work, so then everything must be great. And I actually had a friend come to me. I was recently married, and everything should have been perfect, and I just was an absolute mess. And a girlfriend came to me and said, I think you're depressed. And I looked at her, me? I'm Hillary. I've always got a smile on my face. I've always got it together. And she said, you don't. You think you do. You tell yourself you do. And I really think that's sort of, I wasn't aware of my own self-awareness, but that's what therapy taught me. Therapy taught me my triggers. Therapy taught me the things to look for. Therapy taught me how to manage those daily stressors and how to really check in with myself and make sure I'm doing the things that I need to do on a daily basis to stay healthy.
And in hearing both of your stories, you know, I hear something as common as crying this morning, or was a mess and was crying, or was in my car thinking, I don't even want to drive to this place I'm going to. And then you juxtapose that to what you said, which is this caricature that media makes about what mental health, and then ultimately potentially later on down on the continuum mental illness is. I'm going to go back to what I remember growing up seeing before there was social media. It was Britney Spears has depression, so they put the celebrity name and the disorder, shaves her head. Lindsay Lohan has anxiety, dresses like a hot mess, puts lipstick all over her face, can't get it on the right way, right? And then you even fast forward to social media now, it's Kanye West has bipolar, says crazy things about his family, and thinks he can run for president, right? It's so important for everyone out there to hear the day-to-day of foggy brained, crying, discombobulated, right? Like I could make up all these terms, but numb, getting by, struggling, right? Like, and then what we do as human beings is we justify those feelings by saying, I didn't get a good night's sleep. I'm not, by the way, docs, I'm not saying sleep isn't important. I'm just using as one example that us commoners use to just, oh, I didn't get a good night's sleep. I went out, drank a little bit extra the night before. And then what ends up happening is that cumulative buildup over time of us not dealing with it eventually gets us to this point.
It's okay not to be okay.
Sometimes. I always want to add that in there because I love that campaign when there's a time for it. I also don't want people to think it's okay to be a victim my entire life and to
But
be okay.
that's a different word.
Yeah, okay.
I said it's okay not to be okay.
Yeah.
I didn't say it's okay to be a victim.
Okay.
I'm here today because of my struggles. Proud of it. You asked me on the podcast.
Yep.
You know, we talked about everybody has asked, hindsight's 2020. What would you change? What would you tell your younger self? Absolutely nothing. There was a lesson every single thing that happened to me. Everything happens, everything happens, and there's a message in every single one of them. Can you find that message? There might be a group of people it happened to. That message is going to be different for each one of you. I'm proud of my struggles. I'm here today, So there's a difference between it's okay to not be okay, but it's okay to be a victim. If you plan on being a victim, then obviously, you're going to continue to be the victim, and it's only going to get worse. Every one of us, we all have something. Even the smarty pants that you guys are up here. I'm not my grade 4 reading level, but look at this. Obviously, two beautiful women, smart, doctors, look good, nice socks.
Thank you.
We're all different, but each one of us are special.
I hear you talk about, and this question is going to go to the doctors as I'm sharing this. I hear you talk about being an alcoholic, and I'm going to share. This is me being armchair psychologist. I know myself. I was addicted to something, but it wasn't a substance. It was work. I think you were addicted to work, and that's me knowing you just for this short period of time. And why do I bring these three things up? Because that means that the three of us are addicts in some way. And I'm going to explain what. And by the way, I think everyone in the world is addicted to something at some point in their life. And here's the reason why, and tell me, doctors, if you disagree with this theory. You were addicted to hockey because it took you away from the feelings of what you had to deal with when teachers or other kids were saying you're dumb because you can't read. You were dealing with, I got to be the best lawyer I can be because I'm having these other feelings, like what am I going to do with my car, like I'm crying, but if I can get my work done, I'm succeeding. I know in my particular case, I shared at the beginning in the welcome session, my brother went through all these traumas growing, or difficult life experiences growing up. Those were traumas in my life. I think I worked so hard and loved the day-to-day of sports that it kept me from working on my stuff. So for both doctors, as you see patients coming in your office, do you sometimes have to look out for, I'm not seeing the traditional sense of they're abusing alcohol, they're abusing drugs as their vice to get over whatever they're feeling, but they are escaping things they need to work on by hyper-focusing in other areas of life?
Yeah, it's a great question. I was actually just speaking with somebody recently similarly about this topic, and I'll share a similar example. There's something in neurology called neglect, and if you have one blurred eye, say your left eye is blurred, but your right eye is normal from birth, they actually used to patch the bad eye, and this way you'd be a little less dizzy and you could see where you're going. The problem is that the brain would deem the patched eye as useless. And over time, all the neurons would start to fuel just the good eye and go blind in the bad eye permanently. They never do that today. They always patch the good eye and they force the brain to recognize the bad. And the central nervous system is designed similarly. So if we're going through stressors at a young age, and I know traumas happen at any point in our life, but if we're focusing on a young age, when we start having more and more stressful thoughts, those circuits become active, and the brain starts to think that those circuits are the most important parts of the central nervous system, and the nutrients fuel that, and those nerves grow just like a tree can grow, and all the nerves that want to slow the body down, slow heart rate, slow down digestion, get rid of that inflammatory effects, help with sleep, they become neglected and lose tone. And what starts to happen is we don't realize it, but it makes it much easier to have anxiety. It puts us on high alert. We start having high amplitude brain waves. And naturally, as being human, nobody wants to experience that. And rather than working on the architecture and helping to restore it, working on changing the thoughts that come from traumatic experiences, getting vagal tone to get stronger, challenging automatic thoughts and letting things diffuse and learning all these different techniques, we escape to what takes your mind away from those thoughts, or we avoid situations to avoid the trigger. And so I think it's very common to see somebody that's turning to substances or video games or overindulging in work or academics. And, it could be driving really fast with the music really loud, whatever it is. At some ways, if we heal architecture, our behaviors change. So this is why I'm a big advocate of learning, a whole type of gym for the brain, example, which, we could dive in a bit, Eric.
Sure.
I like that term, gym for the brain, because it's really important. I have so much to say on this topic,
Please.
but I won't.
Oh, okay.
But in saying the busy piece, I remember years ago when I was doing my internship, my mentor asked me, "Why are you so busy?" And I said, "Oh, well, I've got to do this, and I've got to do this, and I've got to do this." And I was going through graduate school. I had 2 kids that were 2 and 4. And she says, "Well, maybe you're just trying to avoid what you need to deal with." And that we create those habits. And all of a sudden, they become second nature to us. Now, another piece to this puzzle is our belief system. Because we are so ingrained. Hillary, you believed that I'm happy Hillary, and this is the way it is. But that's a good thing, because we can work on that and say, okay, wait, this is what your strength is. I mean, look how powerful your belief system is, that you are going. And then when you crash is when you don't have anything to do, because now it's like, oh my God, I'm here in this room by myself. I'm going to cry. And that's the true raw piece of you, but that's also an outlet. And we see it as a negative, and it shouldn't be.
It's hard to be with ourselves. I know that might be a weird comment, but sports executive, lawyer, hockey player, doctor, and you're hearing these admissions from all 5 of us of maybe I was avoiding what I needed to work on. And what happens when we avoid, stuff builds up inside of us. I think the best analogy that I've heard about, and I use myself, is if with physical health, plaque can build in our arteries over time, well, stress and trauma can build in our central nervous system. And when we're able to do the things that we enjoy doing, like work, like hockey, like, activities of the brain and the mind that give us that dopamine hit, well, we're tricking ourselves in a way into believing that this other stuff doesn't matter and we could just leave it to the side. And so, I want to dive a little bit deeper, because from a practicality standpoint, I'm sure a lot of people want to know tools for both Dr. Zadek and Dr. Plenier. Dr. Plenier, you champion what's called STAR exercises. It sounds like Dr. Zadek loved the term gym for the brain. Can you dive a little bit deeper into that?
Yeah, so if you think about it, we take for granted that in 2021 there's a gym on every single corner, but it wasn't like that when I was growing up. When you thought of the gym, you thought of it for professional athletes, bodybuilders. People ate whatever they wanted. Plaque would build up in the artery system, sugar in the circulatory system. Somebody would end up getting heart disease or a stroke. Then they would be told, you have this medical condition, go see a doctor, get put on a fitness plan or start taking medications and supplements. But now it's different. We learn that we all have physical health, every single one of us. Physical health is not just heart disease, stroke, ALS. It's arthritis in the knees and lower back pain and swelling, the 6-pack abs and being in great shape. And we learn about organic and all the things that we could eat healthy. And if we don't, at least we have an idea of what that's doing to us. We know that if we're not taking care of our teeth, we can get periodontal disease. That's why we have primary care. And if we're living a sedentary lifestyle and many different muscles in our body were to atrophy, you would never just do a singular modality for the rest of your entire life, like tricep exercises every single day. Because what about biceps and quads and nutrition and cardio? You would learn a whole gym for physical health. And when you think about everything we talked about, we're going through these challenges at young ages. Brain doesn't have a delete button. Our brain is active even when we don't want it to be, generating stressful thoughts, activating many circuits. We talked about neglect, how there's real architectural changes. So why are we working on singular modalities for the rest of our life? Talk therapy, med management. Why aren't we learning about a whole gym for the central nervous system? And that was this concept of STAR that we developed. STAR is an acronym that speaks to the science, stress and trauma, the things that build up in our nervous system, active, release, and rewiring exercises. The gym for the central nervous system, ACT therapy. What is the science behind diffusion? What happens when we connect with others? What does havening do on the amygdala? What does breathing do on vagal tone? And how do we start sending safe messages to our nervous system that everything's okay with coherent breath work? Same thing with Qigong techniques. What is a meridian point? What happens when they become clogged? And why aren't we learning how all these different circuits are impacted? Why aren't we learning many different modalities to work on different circuits? And some might work for me, some might work for somebody else. I might prefer bench press, somebody else might prefer push-ups, or I might get bored of bench press and I want to try something different, right? So the idea behind this is that we do not need to wait to get disorder anymore. It might be something that happens regardless, just like with physical health, but we're certainly going to try to maximize our fitness, our health as much as we can, taking care of it. We should be doing the same thing with our mental fitness, even at the youngest age, even on a K through 12 level.
I'm probably, you know my story, the only person who's flown on a plane 26 hours to Jakarta, Indonesia, not to go to Bali, but to stay in a hotel room or a banquet hall and learn Qigong meditation, right? Like, I spent the whole week there because I believe in these practices. And this concept of a gym for a brain, when you think of a gym for a body, we've all been to the gym where we see people doing some weird stuff. We're like, what is that they just invented? But it works for them. It allows them to change up what they're doing. Well, we hope it works for them. But most cases, right, it's not just that they're only doing traditional bench press or they're only doing tricep pull down. And so, Dr. Zadek, when you think about Life Editor and you think about when you're training some of your students, in the context of the way that Dr. Pleener just described it, do you see it as modalities are there? Yes, there's a traditional CBT as an example, but there's almost ways in which we can work individually with each patient to figure out what worked for them and come up with some unique strategies for each of them to do the releasing and rewiring that Dr. Pleener's talking about.
Exactly. With my students, it's interesting because the key of psychology is let's fix people. And as soon as they walk into the classroom, my first role is you're not going to fix anyone, right? So and how do we do this? Well, I have them draw their soul. And that's a very difficult thing to do. And they struggle with that. It actually takes them about 2 weeks to do because they're going, well, should it be? What if there's black in there? And what if there's red in there? So, and the reason I do that is because it's training the mind of saying, okay, first I can't grade you for I can't flunk you for your soul. I mean, really. I mean, that would be incredible. So when we take a look at who we are and how we can have this gym, we have to know what our triggers are. We need to know how we operate. I can't ice skate. Always wanted to. So, I
know a guy can help you out.
Thank you. So when we sit and take a look at, how do we train these individuals, it's first judgment has to be off the table. And the first thing as a therapist, I need to know who I am. And then now you need to know who you are. And when we do color therapy, which we take a blank piece of paper, crayons, and you draw your soul, it's amazing what we learn. And sometimes one of my students says, are you a psychic? Because when you're reading it, it's all of a sudden their true self is coming out. So there's so many modalities, and it's really having like a bag of tricks, for lack of a better term, of saying what is going to work for you. And that is so important because we're trained to know cognition. We're trained to know different platforms in therapy. But sometimes you got to put the book aside and say, okay, you're just a human being with a lot on the table, and why is that? And the question is, why? I was lucky enough to be trained not only in the mental health and behavioral piece, but also I worked for a corporation that did a lot of training with mind mapping and really delved into the corporate aspect of the why. So, we had this process of asking 5 whys. It's incredible what you get to when you ask the 5 whys. So we work towards that, but it's really important to understand that your belief system is going to really base the whole treatment. Because if you believe in something, how do I change a belief system? Like, how do I do that? Yep. And I haven't learned that. And the second thing is, how do I erase your memory? Because we think, we have a trauma as a child. We're training these kids from a very young age to be athletic and 4.0 when you get to college. So how do we change that and shift that and train them to just take a moment and say, okay, what about me? Because I've got to walk with me, talk with me, sleep with me, eat with me. I'm like overburdening myself. So how do I deal with dealing with me?
Eric, I want to jump in quickly. Obviously, as an athlete, I worked out my whole life. I got a question. You've done a great job. You've been amazing. I had a question for all 4 of you. What is the strongest part of somebody's body? Eric, strongest part. We just talked about being in the gym, athletically, push-up, bench press. Then we went to, the gym for the brain. So what is the strongest part?
I'm going to say this in the proverbial sense, but their heart, their commitment. I don't know where that would live inside of them, but their drive in some way.
That was going to be my answer as well.
Yeah, I say the soul.
I would say right now the mind, just to complement.
Yeah, and that's why I'll go with you on the mind. You can convince yourself. If you got 30 seconds there, can you stand up here? We're going to do a little exercise. Come on, quickly. This is something powerful. I want you to. I want to stand right there. I want you to stand like this, and I want you to turn. Keep your feet. Turn. Okay. Now go like this. Sorry. Now close your eyes. Now close your eyes and visualize yourself turning. Don't yet. Just visualize yourself turning 2 feet further. Now go ahead and turn. Visualize yourself going 2 feet further. Keep going. Keep visualizing. Right? Why? Your mind. So I just wanted to branch off of exactly what you were saying. Both train your mind.
And the name of this session is the Empowerment Panel. And laying in that bed the way that I did, and I'm sure for both of you when you were struggling, when you were going through where you're struggling, when you're waiting for the Wizard of Oz to come save you, you don't feel empowered. And what do I mean by the Wizard of Oz? If I go to that therapist and they talk to me, and we've seen these images on social media all the time, my brain is this messed up thing of yarn, all tangled together. And the therapist, by the way, not downplaying what the therapists do, but if the therapist can fix me by me going into the office, they can untangle the yarn, and then the yarn, or I got to lay in bed and this medication will eventually kick in and create this balance where there's an imbalance in my brain. I think what has been shared on this panel, obviously we don't have the time to go through all the modalities individually that we just shared. You guys touched on them, pieces of them, is being able to grab back that power and say, if I put weight on, I can go to the gym and I can get on the treadmill, I can get on the elliptical, I could go boxing, kickboxing, I could do anything. If there is plaque built up in my arteries, I can do some more cardio and try to work to burn that off. The same thing is true with mental health. When we're not feeling well, whether that looks like struggling, whether it looks like crying, whether it looks like anger, whether it looks like fatigue, we have the ability to take a proactive approach. Now, sometimes it takes a doctor holding our hand and showing us what those modalities are. Sometimes it's talking with friends early on and being a little more proactive. But isn't that such a big shift in this construct overall of how we think of mental health as a society, to go from being something happens to me and then someone's got to give me something to fix it versus I actually have control over how I feel?
You summed it up for me so perfectly. When I received my diagnosis over 10 years ago, and we were in a totally different place with our conversation about mental illness and mental health, I felt so helpless, and that every way that I was going to get better had nothing to do with me actually taking control and doing it. It was going to be a medication. Well, then I spent 4 years trying to find the right medication, and that's a struggle in and of itself, because when we're dealing with mental health and brain and body chemistry, what works for me isn't going to work, may not work for the next person. And I felt so helpless. And it wasn't until that I found other options or found ways of saying, you know what, if I don't get enough sleep, that's going to be a trigger for me. If I don't cut out toxic people in my life, that's going to be a trigger for me. If I, stay out too late, that, figuring out all of those triggers and recognizing that I really did have the power and the control over this illness, and that I could be healthy and be stable and have a wonderful life. Once I realized that and that clicked, it no longer became something that happened to me. It became this beautiful part of who I am. I truly think, just like Brent, I wouldn't change my diagnosis for the world. It has given me a place of peace because I know myself now, and it has given me a place to be able to meet people where they are and have empathy and compassion for them, and understand that what someone's showing you isn't always 100% the truth. But it took me taking control and saying, I'm not going to let this happen to me. I'm going to get control of this, and I'm going to find the things that work, and I'm going to empower myself and take control of this narrative.
I love that. I'm gonna share that the first time that I was ever interviewed on a podcast, it was in the sports industry, and the person asked me, Eric, how do we best screen for people who have mental health complications? And I had to bite my tongue almost a little, and I wanted to jump through the phone. I was being asked, and I gave a little bit of a facetious response, and I said, well, if you want to hire the CMO that their brain can't go to that really awesome place of creativity, sure, let's screen for mental health. And if you want to hire the CFO that doesn't dot every I and cross every T and make sure that the decimal places are in the right spot, sure, let's screen for mental health. And I think that's such an important understanding for everyone up here, is that there is an empowerment angle of the challenges we face. Our greatest strengths are sometimes also our greatest challenges, and that's okay, right? Like, to be perfect is not a possibility. Brent's favorite line is, we all put our pants on the same way, right?
Well, the women drop off the bed to get in the Lululemons, but,
Yeah, but it's, that normalization, I think, is so important for us. And especially, can I ask you this question, Hillary? Like, when you're with your law firm now, as you're talking either with other lawyers or you're hiring yourself, do you notice that now when you're interviewing? And I know there's HIPAA violations and stuff like that, but do you notice to not look as deeply as, oh, that person was a little nervous when they were asking the question, or they stuttered a little bit when they gave their response, to be like, you know what? There might be a lot of character that was built up in that person because of some of what they've been through?
Absolutely, but I practice that in my daily life. I really truly believe that all of us have something going on behind what we show, and it's not something that people are always going to share. But I am vocal about sharing my story with people that I meet, because I want people to, not look at me and say, oh, you run a law firm, you're running for office, you run a nonprofit, you must have it all together. And most days I do, but one of the things that I'm really vocal about is making sure that you check in with yourself. I ask myself every day, how am I? I wake up and say, how are you today? Because we do that with everybody else in our lives. Every text message we send, every phone call, every email, how are you? And I ask myself that to make sure that I know where I'm at. And I know that when I meet people, people know my story. And if they don't, I accept what they're presenting may not be 100%. They may have had a bad day, and I'm usually one to give a second chance because of that.
We've got a minute left here, and tell me if you all felt this way. I haven't felt like I've been on a panel. I felt like I've just been having a conversation with friends about a topic that we're all passionate about, and I hope everyone takes away that same feeling. Maybe give you each 15 seconds. If you wanted to leave everyone, we'll start with Dr. Plea and move our way down here, leave everyone with something from this session that allows them to look at whatever challenge they're facing from a mental health perspective and think of it more as empowerment than something that's holding them back. What would you say?
I think that, if you think about physical health, just because we hit a point where we have diabetes or we end up having sleep apnea, there's always ways that we can improve, reverse. If we have an inflammatory condition, we could always learn how to minimize that inflammation and have great quality of life. There's so many things that we can do every single day to prevent even getting to that point. The same thing applies with mental health. If you're somebody that is just going through life challenges, you could start working on STAR modalities, learning about it, check out resources, see various therapists that practice this integrative mindset, and start building mental resiliency, just maybe not to the point of disorder, but just so you could optimize your fitness, think, feel, and function as best as you can.
I'm laughing because as we're looking at the clock running out right now, I'll end on saying I think Dr. Pleener's been hanging out with me a little bit too long, and that going long-winded and giving a long response when we've got a bunch of people. But hopefully that answers on behalf of the panel here. This has been an enjoyable hour plus for me, and I hope everyone else enjoyed it as well. Thank you all for having us.
COVID-19 pandemic has forced us to make changes on so many levels.
Feeling alone and isolated is something that we've all felt, and not knowing what to expect has made life a lot more challenging.
Just as our bodies need to be fit, so do our minds.
And the best part, there is no cost if you're covered by Medicaid or health insurance. If you're not, there are flexible plans that can adapt to your family's needs.
All you need to do is call